we're going to do something special now, and that is offer a tribute to Dr. John Opitz. And for that, we have Dr. Malgorzata Nowacek. And Dr. Nowacek teaches undergraduate students in the McMaster Bachelor of Health Sciences program, medical students and postgraduate trainees in pathology, pediatrics and obstetrics, gynecology residence programs, as well as CCMG-administered clinical genetics fellows. The major focus of Dr. Nowacek's research is genetic disorders, both at the basic sciences and clinical level, and she's published many articles on Smith-Lemli-Opitz syndrome. We're grateful to have her here today. Ladies and gentlemen, Dr. Nowacek.
Hello, everybody. I'm Margaret Nowacek, a member of the Medical Advisory Board of the Smith-Lemli-Opitz Foundation. It is a great honor and privilege today for me to speak to you about John Mary's Opitz. John was born in 1935 in Hamburg, Germany, and lived through the war years in Germany. During the war, he contracted tuberculosis and was in a sanatorium for about 14 months before rejoined his mother in Nuremberg. He immigrated with his mother to the United States in 1950 in Iowa City, where he studied undergraduate biology and graduated from medical school at the University of Iowa in 1959. Subsequently, he lived in Wisconsin, Montana, and finally in Utah. His list of honorary degrees is too long to list here. He was also a fellow of the American Academy of Pediatrics, a diplomat of the American Board of Medical Genetics, and a founding fellow of the American College of Medical Genetics, which has subsequently become the American College of Medical Genetics and Genomics, a college that he and his colleagues started in 1998. In the last years of his life, he was a professor of pediatrics, human genetics, and obstetrics and gynecology at the University of Utah School of Medicine. As I mentioned, he spent his childhood in Germany, and here he is in front of the house where he lived for 5 years with his mother in Nuremberg. And finishing high school, he obtained his bachelor's degree in zoology in 1956. And here we see young John feeding a bullfrog in the Department of Zoology, which was a part-time job for him that allowed him to continue his studies. He graduated from medical school in 1959. Here he is at graduation, and the lady with the cat eyes is with the cat eye glasses is his mother. During medical school, he was very interested in various areas of research, and he studied sex determination and sex differentiation in various animal species. He studied glucose metabolism, prostate cancer, and hereditary hematuria. And as you can see, there's some budding interest in genetics. John was always the tallest in any group. Here you see him at in the group of interns and pediatric residents at University of Wisconsin. He, of course, is the first one on the left, the tallest of the group. I remember when I first met him, I came up to him and I said that he must come from another planet where people are very, very smart, very, very kind, and very, very tall. He smiled at that. At University of Wisconsin, as you can see, he worked with patients, but also with other species. Here he is inoculating horses against smallpox. In 1974, after finishing his residency and becoming a faculty member, he established the Wisconsin Clinical Genetics Center for Fetal and Pediatric Pathology and for Developmental Pathology, together with with Dr. Enid Gilbert Barnes, who became his lifelong friends. It is from this year that the publication that we all know about comes. In 1964, he and his mentor David Smith, as well as a colleague Luke Lemli, published on 3 boys with similar facial features, developmental delay, intellectual disability, and a pattern of birth differences that we are now very well familiar with. It was interesting that in one of his talks he mentioned that the boys were so similar that one of the mothers actually confused the picture of another one with that of her son. And here also is the reason for Smith-Lemli-Opitz syndrome being called RH syndrome. John was against using researchers or doctors' names as eponyms for the syndromes that they discovered, and he proposed a different naming pattern, which was that from the first letters of their last names. And here, this is where the R, H, and S come from. John continued to write about many different syndromes while in Wisconsin and subsequently in Montana, but amongst many of his accomplishments was the founding of the American Journal of Medical Genetics, one of the leading journal on clinical dysmorphology and clinical genetics in the world. And I say in the world because he was quite adamant about publishing papers from around the world, not just North America. Many of us who have submitted papers to this journal are proud owners of a page like the one on the left, covered in red writing and red edits. These are John's himself. Every single paper that was published in the American Journal bore his trademark red pen and his editorial wisdom and improvements. I am a proud owner of several of such papers myself. Here on the right, you see John Opitz together with Dr. John Carey on the left and Dr. Max Moenke on the right, who were the subsequent editors of the American Journal of Medical Genetics after John stepped down. From 1979 to 97, John lived in Montana. He was invited there by Dr. Pallister to become the director of the Regional Genetic Service Program in Helena. He also served as the head of the Department of Medical Genetics and an adjunct professor of biology, history and philosophy, medicine, and veterinary science. In 1994, he was appointed professor of medical humanities there. It was in Wisconsin and Montana that the so-called Opitz syndromes, yes, they are known by his last name to his disapproval. The number of syndromes were described by John and many of his fellows and mentees, and these syndromes are well known to clinical geneticists around the world. In addition to writing hundreds and hundreds of papers, dozens of books, many chapters in books, and presenting at meetings around the world, John always or frequently attended many of the family meetings. Unfortunately, I don't have a photograph from a family meeting of Smith-Lemli-Opitz Foundation, but here he is on the far right at the Cornelia DeLange meeting in Salt Lake City. I personally met John in Salt Lake City in 1998 when I was just a brand new faculty member and went to my first Smith-Lemli-Opitz Foundation meeting where I actually had the privilege of diagnosing a boy who came in as a patient, as an individual with Smith-Lemli-Opitz syndrome, as having a different syndrome, which was FG syndrome. And John was actually quizzing me on that, and I was very proud to say that I garnered another smile. In 2006, John had a Festschrift in Salt Lake City again. A Festschrift is a meeting of colleagues from around the world who present papers on the accomplishments of the given person. And here he is again with me. Please, I don't know what happened to my hair. And Dr. Gilbert Barnes again. Another contribution or an honor in his name is the John Opitz Young Investigator Award. Established in 1998, so over the last 25 years, many of the awardees have become trailblazers and leaders in medical genetics and clinical dysmorphology around the world. Here we have John Carey and Dr. Angela Lin presenting the meeting at the David Smith meeting, the 2022 and 2023 winners of the Young Investigator Award. As I said, John's honors are not limitless. There is an end to them, but there are too many of them to list. Here are just a few. At the bottom left, you have John receiving the Order of Merit of the Federal Republic of Germany in 2016, and on the right, receiving an honorary diploma from the University of Bologna. In 2011, he received the highest honor of the American Society of Human Genetics, the William Allen Award, for all of his contribution to science and to clinical genetics. But lest we think that John was all about science and all about research and all about patients, I'd like to tell you a little bit more about other sides of John. He was a family man. His 3 children from his first marriage are here on the right, and his second wife, Dr. Susan Levin, and their daughter Emma are in the top right. At the bottom, you see John with his daughter, the little smiley one from the black and white photo, with her husband, her sister, and her own daughter, John's granddaughter. John loved animals. Top left is Sweet William, a chinchilla they used to purge on John's nape as John worked on the journal. In the top right, there's Emma examining kitten Igor for his scoliosis and polydactyly, extra toes, and a pet Sun Canur, which I can only imagine is some kind of a tropical bird reading together one of John's books. John was a lover of nature. He hiked the mountains whenever he could, whether it was in Montana or in Utah, and he enjoyed it to the very end of his life. John died in Salt Lake City, surrounded by his family, on August 31st, 2023. The genetics community of the world was saddened by the passing of such giant, but we were all better people for having known him. Thank you, John, for your friendship and mentorship and guidance. And thank you to Smith-Lemli-Opitz for sharing the photographs of her father. And thank you for allowing me to present this to you today. All my best and all the best wishes for a successful and fruitful conference in Boston this year. Thank you.